Welcome everyone. I'm Catherine Daria, volunteer and training coordinator with Sacramento Steps Forward, and we also have Alicia Music as our tech host today. Today's recorded Lunch and Learn is an introductory discussion around providing trauma-informed support in the COVID era for persons experiencing homelessness. While we wait for others to join, we encourage you to update your profiles like shown here in the example on the screen. And if you have content-specific questions, please submit them in chat and we'll plan to address them during Q&A. Alicia, can you please launch our poll here to see who's in the room so far? Excellent.
Live?
Yes, thank you. All right, so while we'll give you a moment to reply while we review our agenda. So thank you all for starting to submit those replies in there. The long-standing mistrust, anxiety, and fear among people experiencing homelessness, or PEH, only amplify the health inequities among this population. Their histories influencing their desire to access healthcare and services, and in turn impacting their health decision-making. While there have been a lot of efforts to support this community throughout COVID, the pandemic has surely magnified the gaps in healthcare and services. So we'll be reviewing briefly today the state of COVID in Sacramento County and update you on our vaccination progress. And then we hope to also start a conversation around how we can use trauma-informed lens in helping these communities navigate the COVID vaccination process and to explore mental health support for PEH and PEH serving individuals. As part of SSF's COVID outreach, we offer this conversation for you all our COVID vaccine ambassadors and our current or aspiring vaccine advocates to help our county's most vulnerable gain equitable access to COVID prevention resources and the vaccines, of course. We do hope to provide more intensive trainings around this topic in the future, so please do watch out for more details on our SSF website. All right, so before we dive into our content today, Alicia, can you please show our poll results? Close our poll. All right. It looks like we have a variety of folks from advocates, housing providers, and health and social service providers, and we have some falling under the other category. We hope to hear from you all later. All right, so let's close this. Jumping in. Okay, so this map shows the share of the population that's received at least one COVID vaccine dose in Sacramento County. In the vaccine equity metric quartiles based on the California Healthy Places Index. As the map moves from gray to orange, we see a higher concentration of the population who have received at least one vaccine dose. The quartiles are represented by the dots. Now we're looking at Sacramento County's progress in vaccinating communities with the most urgent need. We're currently viewing by vaccine equity metric, which is what's dotted here in this map. And so we have our partially vaccinated, fully vaccinated, and not vaccinated. And then now we're looking at our vaccination by race and ethnicity. And so we have, again, the categories of fully vaccinated, partially vaccinated, and not yet vaccinated. Note that these charts are updated by the state every Wednesday. So if you're interested in keeping up, the link is going to be made available later. So SSF is part of the statewide COVID-19 Community Health Project, or CCHP. It's running through July 2021 and is supported by the Center at Sierra Health Foundation and the California Department of Social Services. The project goals are outlined here, and we're pleased to announce that as of last week, we've administered 1,743 doses of the COVID vaccine. In the previous slides, We looked at data focusing on populations who received at least one dose for a reason. For context, the one-dose J&J vaccines were primarily provided to this population, but we then modified our vaccine dose tracking methodology after offering Moderna in place of J&J during its pause in April. So we've partnered with Sacramento-based organizations, encampment champions in Sacramento County Public Health to deliver education, vaccines, and other resources. Here are some of our vaccination team preparing for a day of engaging with community members in the kits that they have prepared and distributed. So some of the challenges we're facing now include the declining vaccination acceptability and follow through, as we've already engaged a large number of individuals who are highly motivated to get vaccinated. We've also been branching out into different areas in the county, but currently have insufficient information on locating additional sites in need. We're also seeing limited funding to support wraparound services and incentives, as well as a growing concern for further displacement and violence as we prepare to reopen. Earlier, I mentioned that previous trauma affects our decision-making. Here's a graphic of decision-making and behavior pathways. And falling under the umbrella of trauma and are poverty, domestic and gender-based violence, racial discrimination, mental health disorders, and many more. In the interest of time, we won't be doing deep dives into the previous theories and these principles today, but these themes will likely carry over into our discussion in a moment. So today we are joined by 4 experts serving the Sacramento community who each have incredible and diverse behavioral health backgrounds. To kick off our discussion, let's have our panelists unmute by order of the photos on the screen. Then if you could please briefly introduce yourself and tell us about how your group has established a supportive, trauma-informed community for PEH. And so we'll start with Janelle.
Hi, my name is Janelle Surrey-Miller. I am the program director for the T-Core program at Hope Cooperative. What we have done, I think the main thing that we have done to serve this population is remain flexible, remaining flexible and open and creative. This pandemic has definitely, I think, tested my staff 100%, and I feel like we have been surviving and thriving all through it. So I think that's it, and I'll pass that on to the picture to the right.
Y'all are selling yourselves short. No, as part of Sacramento County Department of Behavioral Health Services, the division, we do work with all our providers, and trauma inform is deeply ingrained into the design of all of our programs. So everything Janelle said is exactly right. We encouraged flexibility. People could meet over the phone, meet out in the community, people could Skype, people could text. However, they could make contact with clients. We also provided PPEs for our different programs and for the folks in those programs. And that's on the client level. On a program level, we really stepped up our collaboration with Sacramento Steps Forward and some of our shelter providers, where we're meeting weekly to case conference the individuals at the COVID shelters. So we have the housing providers and we have the behavioral health providers working together to coordinate care and make sure we're supporting each other's efforts. And that's been a pleasure to watch. Christy?
Good afternoon, everyone. I'm Christy Gonzalez with WellSpace Health. I'm Deputy Chief of Behavioral Health Operations with WellSpace Health. And that basically means anything that is outside of our medical or our dental operations is probably called behavioral health here at WellSpace Health. One of the main ways that we've really kind of lived a trauma-informed approach during these last crazy 18 months is to really just try to extend a little bit of grace to our staff members as well, too. I know we'll talk a little bit about that that later today. But really understanding that our staff and our employees that we have that are serving this population and serving the community at large are just as impacted by COVID as those service recipients that we serve as well too. And so we really try to make it a point at WellSpace Health to kind of take a step back and say, okay, where can we be flexible? Where can we give a little bit of understanding? Where can we give a little bit of empowering with communication and education, especially in those early days of COVID when so much was still unknown and unsure? Gwendolyn.
Good afternoon, everyone. I am Gwendolyn Jenkins. I am the Director of Transitional Care at WellSpace. Transitional Care is the division at WellSpace that bumps up against the population that is experiencing homelessness. That is not the only population we serve, but that is a large part. We have a street nurse team that goes out and meets clients where they are, and they've been doing that the entire time over the last 18 months. We have an interim care program that works with the hospitals to find a place for people to be housed post-hospitalization. We're working with the city with our Pathways program, and we also have a substance use resource and engagement program that we are working with both homeless and housed individuals. And it has been a challenge, not only, as Christy said, for the clients and the patients, but also the staff. And at WellSpace Health, we are trauma-informed organization, so we approach everything we do in that way. And looking forward to our discussion today.
Well, thank you all for introducing yourselves to our participants today. We're excited to hear more from you. And with regards to Christy's comment about everything else that's not under medical or dental, under behavioral health, I think that makes it easier for everyone to really classify those services and to access them. So just jumping into our first individualized question here to Janelle. I'm curious to hear, what's the most critical piece of trauma-informed care to you, and how do you make sure that you're integrating this in every interaction?
Yeah, so I think the first step, or the first and foremost, is going to be a true understanding that you are just looking at an individual, and understanding that most likely individuals, myself, everyone on this call likely included, has experienced some level of trauma. And we come from that place of I hear you, I see you, I understand you, I think we can provide better care. So really remember coming from that humble place and understanding that our job is to uplift and encourage and not re-traumatize, which I think that sometimes when we're not careful, we can in fact re-traumatize people. And when I think about the homeless population, the unhoused population in particular, that in itself is one element of trauma. If you have ever had to really think about where you're going to get your next meal, where you're going to rest your head, am I going to be safe? Are my children going to be safe? When you have to really think about those things, that's an indicator, to me at least, that there is some level of trauma. And so I know that for a lot of our programs now that we have funding, part of that is to eliminate that piece and hopefully get folks housed and to a place where they can tend to the mental health needs, which surely are to follow. So, and I think that one of the biggest cliches that we say when thinking about trauma-informed care or practice of trauma-informed care is really looking at the individual and not saying like, you know, what's wrong with you? Which I think maybe at some point in time we are tempted to say because of whatever we're going through. So really looking at the person about like, what have you, rather than, what's wrong with you is, what happened to you? And how can we be of support? And finding those moments where you can understand an individual for that individual and their experience, and then move forward to a moment of from recognition to empowerment. So once that we can teach our clients that they are capable of so much more than they're capable of, then that will bring them to a point of hopeful success in whatever level of success that means to them. What else can I say? As far as like, how do we implement that here? I think that that's through, the core teachings, but also modeling the way. It's how we interact not only with our clients, but how we interact with our staff. So I know, like, when we have to have difficult conversations and considering how we show up in those conversations, that's really important in order for us to move forward, is really recognizing what we bring to any collaboration or discussion, checking ourselves and our own stuff, if you will, before we address any other person, because that stuff can be felt. Any inauthenticities can definitely be felt. I think that as we go through this process, more ideas are going to popcorn in all of our minds. So I will leave this to open up the discussion and see if there's anyone else that has any additional input or points, and I'll pop right back with you.
Thank you for that, Janelle. Any comments from our other panelists?
I really appreciate Janelle saying we can't look at people as what's wrong with you. We need to look to folks as what has happened to you. I think every person strives to be the best person they can be. And when they struggle with that, my first assumption is that they encounter difficulties, challenges, or trauma. So I am not going to take that behavior personally. Thank you, Janelle. That was like not what's wrong with you, but what happened.
That one's huge. And once we get through that one, we can conquer so much more.
I totally agree with that. And that's part of the empowerment piece, right? And so if we can make them feel that we're with them and that we're really understanding the core issues of what's brought them to this state, then we can work then towards providing them the resources so that they can be more self-efficient, and then that they can feel empowered to make decisions for themselves later on, beyond that interaction in itself. So thank you all for sharing those thoughts. So I'm going to be opening up this next question to you all. We're making our way to vaccinate homeless individuals across Sacramento, as we've shared earlier, but you may have also heard that COVID vaccination has plateaued and declining at this point. Can you please share with us techniques and practices that we can use to combat trauma, mistrust, and fear in our interactions with this population? And so by we, meaning our vaccine ambassadors and our medical providers and our general volunteers.
I think one of the first things we need to do is establish trust with our client or our patient. They need to understand that this interaction with us is a safe space, that we are there for them, no judgment, regardless of behaviors. I think that is step one, because once the patients and the clients feel safe, now you can have a conversation. You can start the process, but without that, the car won't even start without the safety factor being there. So I think that we all need to kind of be really cognizant of that when we are establishing that rapport with our clients.
I would also add to that, be aware of the power differential. There's automatically a power differential with us being the helper and them being the helped. Be very aware of that dynamic. What I try to do is meet people where they're at and provide psychoeducation, demystify all the fancy words and all the psychobabble we use, and just have a real conversation with them. Meet them where they're at, be aware there's that power differential, and try to make it as equal as possible.
That is so true. Also, we talk about building trust. I think also about transparency. When we're working with, I think some of our higher risk, higher need populations, they begin to be a really good read for people. And potential intentions or concerns about intentions or fears about intentions. So the more that we are open to build trust and being transparent while doing so, I think that's going to take you a long way in working with any individual, traumatized or not. Because the relationships that we have are so critical, and for someone to feel a place of vulnerability and feeling safe and secure with being vulnerable, that's going to require them to be able to also see you as an individual, not as how Monica said, as this worker who just gets paid to talk to me and sign papers for me, because we're so much more than that for the clients that we serve.
And I would say all of that takes time. We have to understand that this work, especially with this population, it cannot be, like a regular kind of flow where we expect to see a certain amount of patients in a certain amount of hours, or have a certain amount of touches on street outreach, whatever it might be. It's going to take time. We have to have individual conversations and meet that individual where they're at. And we have to do that through communication, through conversation. And so we have to give a little bit of grace, again, to our teams, to our staff and our employees, and know that this is going to take a little bit longer than our normal workflows, and that's okay. We have to give permission for those relationships to develop.
See, that's a great point about giving time to those interactions and for those relationships to grow. Just a follow-up question on that. Especially for the vaccine ambassadors who are going out there on the field, typically there is not time on their side in order to kind of really build that rapport. And so, and sometimes there are 20 to 30 folks are out there, and sometimes it's a more of an intimate group. And so you can dedicate that time to them. For those cases where it's kind of managing that small to large group, how can ambassadors create that time spent while making sure that they're addressing each individual who's come out to that event?
One thing I might say right away is the first thing you have to do is you have to ask questions. Where is this person at in their education of vaccines, and in their education of COVID, and in their education of its, how it's transmitted, right? So the first thing I think I would do is just start asking questions. Who here's been vaccinated? They expect it to be a 0, but maybe there's someone who says, yeah, I have been actually, and maybe they can help have conversations too. So I would just say start from a place of questioning, start from a place of wondering, where are we at? What's our baseline here? Whether it's 30 people or 2, where do I start? How do I start with you? I'm not going to start by lecturing you. I'm going to start by questioning, and I'm going to ask, and I'm going to see where you're at, and then build from there.
I want to follow up with Christy on that. Encampments are communities. They're people's home and neighborhoods. And just like every neighborhood and family, there are heads of the family, there are caretakers. Find your allies in the group. Like Christy was saying, by asking questions, you might quickly find out who's kind of the natural leader, who's the natural caretaker. And that might be somebody you want to kind of broker the peace with, and just to help establish that relationship. And also never underestimate small gifts. Our encampment team tries to keep on hand like bottled water, sunscreen, Gatorade, socks. Just making that initial exchange also helps build a rapport. If you have the resources to do that, that works really well too.
And I just want to piggyback real quickly on that one. Transparency is going to be key, because when you come to give the vaccines, especially in an encampment, there are going to be more needs than just for the vaccine. So bring a toolkit, and be transparent with your toolkit. They may need 4 things. Today, I can help you with this, but I can give you a resource for this and this and this. And if you tell them you're going to come back regarding another issue, come back regarding the issue. So that's going to be really, really important. So make sure you have a hearty toolkit when you go into the encampments, because you're going to find, as I know you all know, you're going to find that there are an array of issues, and some of them you're going to be able to help that day, and some of them you're going to just be able to give them resources, and you may have to come back for other issues.
Wonderland, thank you for that. That's a really important note to keep in mind, and thank you for that recommendation. So this next question also goes out to you, Gwendolyn. What internal and external factors can we leverage to improve vaccine acceptability among this population?
Well, I think a lot of this is a fear and lack of knowledge. So I think consistency with going to the encampments, and then as you vaccinate 1, 2, 4, 6 individuals in a campsite, and others see that there are no, detrimental side effects, that alone is going to leverage more people. At least that's what we have found. And what Monica said about reaching out to whoever in the encampment sites, there normally is a care provider, somebody that everybody in that community goes to if they're not feeling well, or they are, we all have these natural gifts and talents. And some of us are just, we're kind of hug people and we're the one who want to take care. Find that person. That's your person. And then also tell them that this vaccine is not just for you. I know you may be feeling well, but in this community, Mr. Jones, he appears to be older than 60 years old, and they're at a greater risk. So that's that knowledge, but it can't just be knowledge pie in the sky. It has to be specific to their circumstance. So you really need to make sure that it's hooked to their circumstances so that it can really impact them. And those are the kind of tangible things you can do when you get into the encampments. And there's another thing the external thing I need you to really consider is self-care. Because in going into the encampments, there's trauma just by seeing some of the things that are going on. So you really need to provide yourself with self-care. And that means exercising, making sure you eat well, get those 7 to 8 hours of sleep, hydrate going in, don't go all day. If this is really, really, I'm a nurse, so I'm gonna harp on this a little bit. If it hurts, drink it away with water. Start with water. Start with water and end with water. So often going into the encampment sites in this heat, I really want all of the ambassadors that are actually going out into the field. Not only do I want you to take water with you, I want you to be prepared to hydrate yourself. And I think those are just very tangible things that you can actually do. And I think you'll see some impact if you take those on as practices.
It's a really great reminder again, Gwendolyn, with the basics, right? With water, most of our outreach events, we do make sure that they are in chunks. So they're like usually 2 to 3 hour chunks, and especially with the as we get into the summer months and the fire season's coming, we're not just thinking about our vaccine ambassadors, we're also offering these resources to our community members. So what would they need during this time? They need their water, they need access to food, and especially with the reopening tomorrow, a lot of concern has been raised around that. What kinds of services and resources will now be available that wasn't previously available during COVID, and how can we help them? How can we help our community members get access and understand how to use those resources? Any follow-up comments from our panelists on what Gwendolyn has just shared?
Psychoeducation. I'm a big fan of the idea that when you provide people with accurate information, they tend to make good choices with it. And that might mean you need to alter your information. You might need to break it down. You might need to make like a handout that explains the vaccine or concerns. You might have to do some myth busting. So, assume the folks we're working with will make good choices with good education So give it to them.
Thank you for that, Monica. So this next question goes out to Christy. What opportunities, this is a two-part question, what opportunities are there for our community to, one, improve social and health services access for this population, and then two, support for our staff to reduce their fatigue and prevent their burnout?
Wonderful question. I think probably the first thing that we could do as a community to better serve this population of folks who are experiencing homelessness is to be a little more flexible with our rules and our protocols and our the way we function. You know, I think of it from a health center point of view. Of course, being from WellSpace Health, we have an appointment. Your appointment is exactly at 8:45 at exactly this location. You know, and we've all been to the doctor before, the dentist before. Maybe we're running a little late, and they say, "Well, you're late. Well, now I'm going to have to put you on standby." You know, or some sort of protocol that's at a doctor's office or something like that. And I think the first thing we can do is just extend a little bit of flexibility and a little bit of understanding around those types of protocols that we have in our own organizations. You know, one of my colleagues said to me once a radical notion: appointments are there for our own use. They're for the convenience of us, the service provider. They're actually not very convenient for the service recipient, because they want what they want when they need it. They don't want to wait until next Tuesday. They don't want to come back at exactly 9:30. They want what they want when they want it. And so I encourage all of us on this call today to really think where in our protocols and where in our rules and policies and functioning, where can we extend a little bit of flexibility? Where can we have things that are maybe a little bit more on demand, services on demand, a little more open access, you know, flexibility for receiving services? You know, it looks different for all of our organizations, but how could we maybe extend a little bit of that flexibility to them? The second thing I would probably encourage our community to really think about is, we can all be in a room together and we can use acronyms that we all understand, and we could use terms that we all understand. But we have to understand that when we're talking to community members, we need to speak plain English or Spanish or Farsi or whatever language it is we're communicating with that community member in. And it doesn't mean we're in any way talking down or dumbing down the information. It's just, I'm not going to use this industry lingo with you, right? I'm going to say this in a way that really makes sense to you, and we're going to be able to have communication in this plain English way. And it goes back to Monica's point about that power differential. When we use language that feels official, you know, people start to kind of be a little on guard and say, oh, you know, I don't quite understand what that means, and maybe I'm not quite willing to say, what does that mean, and stop us. The second part of your question around staff and how can we really support our staff that do this work every day. We need to really check in with our staff daily on how their experience has been and how was today, and you know, what went great, what didn't go great, what are your highs and lows, what are your successes and wins. You know, a lot of different types of ways to approach that conversation. But those of us that are supervisors or managers need to take time out of our day every day to check in with our staff who are doing this work. Let them know we're interested, we're curious, we're there for them. And those of us on this call that are our line staff, if you're the ones actually going out and doing that work, make sure you're telling your supervisor. I would really love to just have a 5-minute phone call at the end of the day to check in and just kind of debrief and decompress a little bit about some of the things I saw and some of the things I heard today. And lastly, I would encourage those of us who are supervisors and managers to encourage our team to take their paid time off. It's a really radical thing to say right now, because we've all been going at 100 miles an hour for the last 18 months, and we feel like we are having staff shortages and there's never enough hours in the day. But if we don't encourage each other and our team members to really use your paid time off, schedule that day off just to be able to turn off, whether it's for a day or a long weekend, we're going to burn our teams out faster than we already have. And I know all of us have felt it in some way. So really have that conversation with our team members about saying, when's the next time you're taking a day off?
Those are really great points, Christy, and that just shows that there needs to be that cultural shift in that prioritization within our staffs, so that we can make sure everyone is at their best mentally and physically, so that we can offer our best selves to our community members. Because if we aren't taking care of ourselves, how can we appropriately do that for our community, right? I did want to check. Oh, go ahead.
No, I think I want to piggyback on that, because as a helping community, we are so quick to just run around and do whatever it takes. That's what everybody says, whatever it takes. And a lot of times that means that we are running on empty. And what I've seen during this pandemic is a group, at least at our agency here at Hope Cooperative and T-Corps, and I can see it all over the place, so I won't claim all the glory, but you know, folks that are so dedicated to the care of their clients and so incredibly just well, dedicated. They just really just want to see their clients do their best, go out there and do what they need to do. And COVID has created an opportunity for us to be creative and to work from virtually anywhere. But that's also important for us as leaders and managers, supervisors, hell, peers, as we look at each other, to really help encourage limit setting. I've seen a lot, you know, folks working through their lunchtime, working through supposed to be, you know, time away, all because they have to make sure that, you know, Susie got what she, that one paper that she needed. And apparently I could be the only person to deliver it to Susie, when the truth is, no, there are many people that can help with many things in so many different ways. And, you know, it took a pandemic to shake us up, to show us that and force us to be creative, but also it's forcing us to look within ourselves to see what can we actually, when's a good cutoff time? What can I do? Maybe I should take a walk, or maybe I can hydrate on that water. I can listen to a podcast. I'm going to go to my car just for a moment, without my phone, whatever it is that we need to do to kind of quarantine ourselves, if you will, to ensure that we're able to revitalize ourselves in a way that makes us our best possible helpers to others, but also not adding to that level of trauma that might already be existent, because we have been so exposed to, goodness, how many things have we been exposed to this year or the past year and a half, whether it's a news conference with death tolls, or if it's you know, going down the street and seeing how many people are really hurting out there. There are just so many ways that we have been exposed and, again, traumatized ourselves that we might not recognize. And now's a good time. And now's a good time to recognize. And yes, absolutely use that PTO, even if it's just to go to your backyard. No harm in that.
I'm on board with that. Get some nature and fresh air. And it sounds like, Janelle, I love that you bring up whatever it takes, right? So it's not just, it's also a change in language in our day-to-day between colleagues. It's not just our language with our fellow community members that we need to change, it sounds like. This is another follow-up to Monica here. I know we've been talking about frontline workers here and the challenges that we've faced the last year and a half, really. curious to hear what tips and resources would you like to leave with our participants here to ensure that they have that they can take care of their mental welfare. Yeah, just to add on.
I actually took notes. I had like a gajillion ones, but I tried to prioritize them. First, recognize the work you're doing. It is okay to pat yourself on the back to be doing this work. Not everybody first wants to work with other human beings in the first place. Not everybody wants to help other human beings. Not everybody is willing to go on the front lines to provide that help to human beings. So give yourself credit and value for the work that you do. You are part of the solution to the problem that we're having in our community. It's okay to practice compassion towards yourself. Just the same way you wouldn't push your peer or your coworker to work through that lunch, have the same expectations for yourself. So the expectations of kindness and compassion you have for others, turn those inwards and really take care of yourself. Validate your feelings. I always say no feeling is wrong. What we do with them, that's up for debate, but you're going to feel all sorts of ways, and it's okay to feel all sorts of ways. It's okay to not feel okay. As helping professionals, I think we have the standard for ourselves where we have to be perfect and the perfect coping skills and the perfect person. I'm always even keeled. No, you're human. So it's okay to not be okay. And then find the positive that you can in the work you do. So instead of focusing on the folks that maybe didn't want the vaccination, focus on all those folks that did want the vaccination. Focus on those moments where you used your smile or you used your compassion or you gave out a supply and you made a connection with another human being. And part of being trauma informed is just being aware also of how it could impact you. So the same way you're treating your clients, you need to treat yourself. It's okay to not be okay. And obviously there's the water, eat your breakfast. I'm going to leave that to Gwen. She's got the medical background. But find ways to recharge yourself. Hobbies. I meet once a week with my girlfriends, no matter what, for at least an hour, just to gripe. Nothing special, no activities, no movies, just an hour a week to gripe. We might do it on Zoom. We might do it in my backyard because of social distancing. But again, the same way you expect to take care of other people, you need to take care of yourself. And please don't lose sight of the value of what you do in this community. Take it from me, and I supervise and hire people. There's a lot of people that are not willing to do the work that you're all doing out there. And that's pretty amazing. So always feel free to pat yourself on the back.
Great tips there, Monica. Thank you for sharing. Before we go into Q&A, I did want to open up to our panelists here. What behavioral health services and resources do you offer or know of that have been critical this past year that you think we should definitely be elevating out there to our community?
Well, I know that a lot of different service providers have really taken advantage of telehealth this year. And so not only for yourself as an employee to make sure you're reaching out to your service provider as needed as well too, but encouraging our community members and especially our community members experiencing homelessness. Some of the telehealth could be video, so maybe they do need a cell phone equipped with a certain level of capability, but some are doing telehealth, just good old-fashioned phone calls. And I know a lot of our community members who are unhoused do have some sort of cell phone, and so really encourage them to take advantage of telehealth for their doctor, their therapist, their psychiatrist, their case manager, all of you that we're constantly working with these community members. Let's really make sure that these most vulnerable people who have traditionally been the hardest to get to that appointment, to get physically to that appointment, take advantage of telehealth while we still can.
Well, our contracted providers have been part of the conversations all along, and Janelle already mentioned it. It's been all about the flexibility. So our entire system has been able to be flexible, providing services the way they need to be. Some of our higher intensity need clients have needed in-person meeting, and we've been able to accommodate that in some situations also. We have been able to continue with peer groups at some of our providers, some self-help groups, and things are slowly opening up, and clients are entering the buildings again. And we do have some extensive listings on our website about other COVID resources, not only for the providers, but for folks seeking resources, and our access line, which is where people call to get screened and referred to our services, has not stopped at all or changed at all during COVID. So we continue to assess and link people.
I can give a little feedback on what we've done at TCOR at least. So we've tried the Zoom to do groups and our clubhouse by Zoom, and we found that it really didn't work out so well. Our population, our people just didn't have access to the technology, and so that was kind of painful. Our clubhouse manager sat on the phone every day on Zoom. Actually, I was with her some of the time to keep the link alive. And she would sit there for several hours from 9 to 3 every day, just waiting for the potential for one person. So talk about perseverance there. And then a lot of our folks recognize that, we still need to be out in the community. So they started keeping chairs in their trunks. Taking camping chairs and just sitting with clients in their front yards, in their backyards, at the parks, wherever may be, and bringing snack bags with them just to keep it going. Go fishing with a client, whatever it is to connect. And I think it was a really good opportunity to connect on outdoors, because we can rely on so many things that are just given to us that we maybe don't pay attention to because we're inside all the time. But clients, we were able to start doing groups indoors. We've been at it for months now. And what they've done is just split the groups into 2. So if we had group A that typically was on Mondays, then there will be 2 versions to accommodate for the amount of people there. And clients really appreciated that. Most often it was about breaking the isolation that was occurring, and being able to again see our clients as individuals with needs, and try to be safe and accommodating. So we talked earlier about PPE, providing mounds of PPE. You should see my office actually. It's a little mini warehouse, and I am putting together packets every day of masks in quart-sized Ziploc bags, so folks can just take them out with them when they're meeting with clients. Everybody's masked up. Same with gloves and wipes and everything in between there. So trying to really make it, and car barriers as well. So making sure that we're creating an environment that is safe for everyone, but also gets the job done.
Well,
Thank
at
you.
WellSpace Health this year, we have utilized our hotline, our crisis hotline. It's listed sometimes as a suicide line, but it's much more than that. Mm-hmm. So our clients, sometimes they just need a little talk therapy. They need, it could be any time of the day. So that has been something that's been very useful. And that is available to anyone to use at all. So that's been a real great resource. And for our moms, and we have used Weave for our female clients a lot. There's been a spike. So those are the kind of areas that we've seen an increase in over the last 18 months or so.
Well, thank you all for sharing your thoughts and your recommendations about ways we can improve our one-on-one engagements and our vaccine advocacy and our mental health, improving our mental health as well. Now I'd like to transition us into our open discussion. We have received some questions already in chat, so I'm just going to lift those up for our panelists. The first one is, I work for Cal Hope and we provide free emotional support and resources for those coping with COVID-19. Most of our services are provided through tech, Zoom, chat, telephone warm lines. Do you have any ideas or examples of ways we can reach the homeless populations?
Go ahead, Monica.
Social media is great. Social media is great, and so is technologies. There are some folks experiencing homelessness who do have access to cell phones and are pretty tech savvy, and there's folks that don't. I still argue the best way is to meet them where they're at physically, at encampments or places they might conjugate for services or resources.
I think also, while we should also exercise some caution when we're out in the field, I think we also need to remember that those who are living in homeless encampments or are otherwise unhoused are people, and we should not fear them any. I mean, I say this with caution, with an element of caution. We shouldn't fear them or treat them any differently than anyone who we would serve in a standardized clinic. I think that, yes, you go out there, yes, you do your outreach, and yes, you provide your services, meet them where they're at. Totally agree with that. But I also just want to add that these are people. These are in fact communities, and they deserve the utmost respect. And I think if we take it back to the idea of providing trauma-informed care, that is number one. That if you are going to work with this population, you must have that ability to really look in the eyes and treat as an individual versus treating a problem, because the individual is not the problem.
I love that, Janelle. You're exactly right, because you go into an encampment, even though I think it's still the best way to outreach, you're going into somebody's home and you have to have humility. You can't just walk in. That might be their living room. That might be their sleeping room. That you go into an encampment, you're going into a home, and just the way you would respect somebody's home and not just help yourself and walk all through it. Same thing when you approach an encampment. So absolutely, I agree with Janelle. You have to have caution and you have to have that humility too.
I had some of my best learning going out there and really realizing, like, oh my gosh, yes. Hey, do you mind if I go over this way? Or where, it's a very organized community for those who don't know, I was working in children's services, and they would pointed me in a different direction, say that the kids are over there. And when and then had someone actually alert them that I am safe and I am not coming in as a threat. And it's the same thing. If someone were to come to my door, I'm going to be cautious and I'm going to be aware, and I'm going to tell you whether or not you're going to enter. So definitely treat with respect. And yes, this is their home. This is their community. So please be respectful of that. Just as if you walk into someone's home and maybe it's not to the standards that you particularly create for yourselves, you're still in their home, you're still in their domain, and you still must walk with respect. Sorry, Gwendolyn, I think you were going to say something and I kept.
I'm trying not to. I always have so much to say, but this particular question, I think she was relating it to also that they do most of their work through tele or phone or that kind of thing. I think one of those areas, we have lots of partners. So I think collaboration and partnership is going to be where you need to go. You need to start there, connections, talk to other programs, present your program, tell them what you do and why you do what you do best and that kind of thing. And I think that right there is going to be a good way for you to really make the impact that you want to make.
And that's a great point, because if you are partnering with your community partners, like for instance, when folks would have a doctor appointment, and this is earlier in the pandemic, and we had staff actually taking their cell phones to the client so that they could get their face-to-face, their FaceTime visit with the doctor. So definitely partnering will be helpful because moments like that can occur.
I know we only have a few more minutes remaining and did want to lift these two questions up around company culture. This one is, how do you suggest we have these conversations with our employers to understand that this trauma-informed approach needs to be directed toward the staff who serve these people as well? I know that is something our agency struggles with, and it leads to pouring out of an empty cup oftentimes. Any comments to that?
Speaking as someone on the leadership team of an organization, I think what I would appreciate is exactly that. I really loved the way you phrased that. Schedule a meeting with your supervisor, schedule a meeting with your supervisor's supervisor, go up the chain of command respectfully and say, I need you to know what the frontline experience is like. And these are things that I think you could do to help support us. A lot of this stuff doesn't really change a whole lot of, it doesn't really take a lot of money. What it takes is a lot of understanding. And one of my earlier points that I mentioned earlier in our meeting was the grace given to understand this work might take a little bit longer. And so come prepared with those examples. Come prepared so that your supervisor and your supervisor's supervisor, you have that example. It took me 97 minutes to convince George to do X, Y, and Z. Whereas normally it takes 7 minutes for someone who's already ready for that conversation to have gotten to that point, right? So come with examples and come with some specific asks. If I could have a little bit more time to do this, if I could have a little bit more resources, like Nurse Gwen says, to come with some water bottles. So if you have a few concrete asks, it's easier for a leader to say, that sounds reasonable, yes, than it does when you come to a leader and you say, it's really hard out there and you don't understand. Mm-hmm. Okay, what can I do? So really spend some time, talk with your peers, come with some concrete asks. It's easier for a leader to say yes when you come with those items prepared.
Any follow-up from our other panelists?
No, that's great.
No, that's great.
You covered it all, Christy. We have a few more minutes remaining, so if you have any final questions for our panelists while we have them here, please feel free to unmute yourself or drop them in chat. Otherwise, we can make sure those that are not addressed, we can follow up with you afterwards. I do have a question while we wait for folks to keep thinking here. Are there opportunities to partner on a shared event providing COVID vaccinations or behavioral health services at your guys' locations?
Not at my location because I'm at an administrative office, but that would be something I would definitely love to talk about. We have gone to health fairs, we have gone to college student resource fairs, so I would love to discuss that.
What would be the best way to reach you? Would you be open to sharing your email here with this group?
For sure. I will add it to the chat.
Excellent.
Same with WellSpace Health. I will drop my email into the chat as well too. I encourage anyone to reach out to us. We'd love to partner.
Any final questions from the group? All right, so just to close us up here, am I echoing? Okay, so well, everyone, it's been a quick hour, but I hope you all come away with new knowledge and new potential collaborations here with your fellow participants. We covered a lot of ground, but I did want to flag some resources for you around trauma-informed principles, decision-making theories, and of course around COVID. I also highly encourage you all to email me at the address here, email address here if you have any outreach questions or information. Our panelists have also started dropping their emails in chat, so please do feel free to reach out to them about potential partnerships. We will be sharing this recording with you later and these resources after this discussion. And so please stay tuned on our COVID outreach page for more information. And so to close this up here, I would like to send a big thank you to our fabulous experts, to you for your engagement, and Alicia for your support. Again, please stay tuned for access to these materials and watch out for more learning opportunities coming soon. We also have a short post-discussion survey that we'd love for you to fill out. Alicia, if you wouldn't mind just dropping that in chat, please. We'd really appreciate you filling that out so that we can better provide future opportunities for you, catering to your needs. And with that, thank you again, and I hope you have a great afternoon, everyone.
Thank you. My pleasure.